everyone, and thank you so much for joining today's NeedyMeds special topic webinar, The ABCs of Viral Hepatitis, hosted by the American Liver Foundation. My name is Carla. I'm the Director of Education at NeedyMeds. And before we get started with today's presentation, I want to go over a few points. You can feel free to ask any questions you may have throughout the webinar by typing them into the questions section of your GoToWebinar control panel. Just know that we will reserve answering questions until the end. If we don't have time to answer your specific question, we will follow up with you personally via email after the webinar by tomorrow afternoon. But of course, we will provide the contact information for both NeedyMeds as well as the American Liver Foundation again at the end of the webinar. Also, the heads up that this webinar is being recorded and will be converted into a video to be available for viewing on the NeedyMeds YouTube page. And here's a quick little plug for the NeedyMeds YouTube page. I hope you do visit it or even subscribe to it because it's a really great wealth of information of previously recorded special topic webinars. And you can find that in the top right hand of the NeedyMeds homepage. Also, copies of today's PowerPoint presentations are attached in the handout section of your GoToWebinar control panel. If you have trouble downloading them, just shoot me a message or send me an email after the webinar, and I'd be happy to email them to you. So with that, let's get started. For those of you that are not familiar with NeedyMeds, here is a slide that shows our mission statement. We are a national nonprofit dedicated to connecting people free and anonymously to programs that will help them afford or save on their healthcare expenses. And we do that through our website and toll-free helpline. And I always put up a snapshot of our homepage because really our website is the face of our organization. And in fact, at the top right hand of that snapshot of our homepage, you can see all of those social media icons. The third one from the left is where you'll find the YouTube channel icon. So I do hope at a later time you peruse the NeedyMeds YouTube channel. Anyway, as you probably just saw on our mission statement and what I said, a big part of our NeedyMeds mission is that we are not only here to connect people to programs that will help them save on their healthcare expenses, but we also pride ourselves on connecting people to other educational opportunities or resources that will help them to stay healthy, which is why we're so pleased to have our guests from the American Liver Foundation. So let me tell you just a quick little tidbit about the American Liver Foundation. And one thing I do want to stress is from our guests, you'll certainly get a sense of the breadth and scope of their expertise, but please do visit their website again when you have a chance. Simply put, the American Liver Foundation's mission is to facilitate, advocate, and promote education, support, and research for the prevention, treatment, and cure of liver disease. So let me tell you a little bit about our guests. Lindsay Ventura is the Community Outreach and Education Manager for the American Liver Foundation New England Division. And you'll notice that map, and I apologize if it's not clear. If you want to see a clearer copy of that, again, let me know. I put that up because I really wanted our audience to see how much representation the American Liver Foundation has across our nation. And even though our panelist, Lindsay, is the Community Outreach and Education Manager for the New England Division, she will give you a sense of what's available across the country. So let me tell you again a little bit more about Lindsay. Lindsay holds a Bachelor's of Science degree in psychology with a minor in education from Northeastern University. Prior to joining the American Liver Foundation, Lindsay worked as a research assistant at Brigham and Women's Hospital in Boston, Massachusetts. In her current role at the American Liver Foundation, Lindsay orchestrates all educational and programmatic delivery for the American Liver Foundation. And again, she does that in New England, Rhode Island, Massachusetts, New Hampshire, Vermont, and Maine. But we do understand people joining our webinar are really representing all states across our country. So please know all of the information that Lindsay and our other guest, Cynthia, will share will be useful to everyone, regardless of where you live in our country. So let's talk about our other guest, Cynthia. Cynthia Banya is the National Manager of Support Services. She oversees the American Liver Foundation's National Helpline, which fielded over 9,000 inquiries last year. She also manages all of the education materials the American Liver Foundation creates and assists with resource information for those with liver disease. So without further ado, I'm going to pass the screen and the mic to Lindsay, who's going to kick off today's presentation. And my goal is to do that seamlessly. So bear with me a moment while we make that transition. And Lindsay, when you're ready, you should be able to grab the screen and take it away. And while Lindsay is pulling up her PowerPoint presentation, just a reminder again that if you have any questions, you can type them into the questions section of your GoToWebinar control panel. And with that, I'll pass it along to Lindsay. Thanks, everybody, and enjoy the presentation.
Thank you, Carla. Can you just confirm that you can see the front page of my PowerPoint?
Absolutely. I see the first slide of your PowerPoint presentation,
Correct.
and you've got it in slideshow, so it's as big as it can be. Enjoy,
thank
everybody.
you so much. Thank you, Carla, for that introduction, and thank you, NeedyMeds, for inviting the American Liver Foundation to take part in today's webinar. Today, I'll be speaking on viral hepatitis. May is the whole month of May is Hepatitis Awareness Month, so this is a very topical webinar we're doing today. As we go, as Carla said, please feel free to type questions in the question box. However, just bear in mind that I'm not a healthcare practitioner and won't be able to give any individualized medical advice. So to begin talking about viral hepatitis, we really need to begin talking about the liver. Your liver is your largest internal organ. It weighs between 3.5 and 5 pounds. It's seated on the right side of your ribs, just right up here on the right side underneath your ribs. Your ribs and a layer of fat provide a very natural protection for your liver, as it is so important. Your healthy liver performs over 500 different functions. Your liver's primary role is to act like a filter in a fish tank. Whatever you eat, drink, breathe, or absorb through your skin is processed by your liver. Anything your body sees, your liver will see in one way or another. Your liver acts as a rechargeable battery. When you eat, it stores nutrients you don't need right away, and when you need them, it lets it back out. Your liver is also responsible for making bile to help digest food. Your liver stops cuts from bleeding, so it makes what's called your clotting factor, essentially your ability to stop bleeding. Your liver also plays a big role in the immune system, killing germs, and it is able to detoxify or break down any substances that might be harmful to your body. Your liver has been described as a large manufacturing warehouse, so it's making a lot of different enzymes and proteins that your whole body uses, while also storing a lot of essential proteins and nutrients for further use. Your liver is also pretty remarkable in the fact that it can regenerate. So our livers are able to regenerate as they become damaged, which I'll talk about in a moment. And this allows us to do what I think is one of the more amazing things about our liver. Our livers are able to regenerate to the point where we can do live liver transplants. In a live liver transplant, we take about half of a healthy person's liver, give it to somebody who needs a liver. Just between 2 to 3 months after that surgery, both portions will regrow to the full size of livers in each person. Your liver really is this remarkable organ that does so much to keep you going. The next slide does have some medical pictures on it, so I will warn you before I switch to that. So these pictures are really showing what the progression of liver disease looks like. Many liver diseases, regardless of their cause, really result in pretty similar damage. So whether it's a virus like hepatitis C, which we're going to focus on today, an autoimmune, a genetic liver disease, or even a lifestyle liver disease such as non-alcoholic fatty liver disease or alcohol-induced liver disease, the damage we see in the liver looks pretty similarly from one cause to the next. So this picture of the liver is what a healthy liver looks like. It's nice and red and smooth. There's no lumps or bumps on it. As the liver begins to get damaged, the first step in that process tends to be hepatitis. The word hepatitis we hear and we tend to think about a virus. We think about hepatitis B, we think about hepatitis C. All that word means, though, is inflamed liver. So try not to think right away of a virus, just think more hepatitis means inflamed liver. If you think about the process of when you get a cut on your skin, First, the area around it swells, and then it's replaced by scar tissue. And that's really that process, same process happens in our liver. So first, the liver swells, and then these scars begin to form, the white marks on this portion of the liver. Those scars are called fibroids or fibrosis. With fibrosis, our livers can really do a lot of what it still needs to do. You might not really start to feel sick if you have some scarring on your liver. And if you're able to remove whatever caused this damage, those scars will eventually go away and your liver will eventually look like a healthy liver again. Fibrosis is usually given a grade. They talk about staging liver disease. With the staging of your liver disease, your doctor's really going to look and see how much scar tissue has begun to build in your liver. This is where you get a grade of either fibrosis stage 0, stage 1, 2, 3, or 4. So fibrosis stage 0, we're talking about that healthy liver there. Fibrosis stage 1, 2, and 3, that's where we're in this fibrosis range where that is reversible damage. So you're starting to see some scars building, they might be spreading out, maybe even connecting to one another, but we're still in that phase of reversible damage. Getting into fibrosis stage 4 is really when we're starting to see people transition from fibrosis into cirrhosis. Cirrhosis is another one of those words that we hear and we tend to think about something like alcohol. Cirrhosis simply means extreme scarring of the liver. Cirrhosis can be a result of something like hepatitis C. It can be a result of a genetic or an autoimmune condition. It's just that point where you have a lot more scar tissue than actual healthy tissue. So where fibrosis can be reversed, there comes a point with cirrhosis where you may not be able to regenerate. It's really important to try to catch your liver disease when you're in this fibrosis stage so that you can regenerate back to this healthy liver. With cirrhosis, if somebody reaches that point of extreme scarring, they're going to require a little bit more intensive follow-up. They might need to see their doctor a little bit more regularly for ultrasounds to screen for liver cancer. Cirrhosis is the leading risk factor for liver cancer, so it's very important to stay up to date with your doctor's appointments, stay engaged in your healthcare, and make sure you're making all of those appointments. So some new research is finding that in some stages of cirrhosis, you might be able to regain a little bit of function, but there certainly does get to a point where there isn't going to be able to regenerate. And so really try to stay up to date with those appointments, like I said. So this progression of liver disease, hepatitis, swelling, fibrosis, scarring, cirrhosis, extensive scarring, and liver cancer looks pretty similarly regardless of the cause of the liver disease. There are over 100 different kinds of liver diseases with many different causes. In America, some of the primary causes we see are viruses like hepatitis B and C, which I'll dive into a little bit more later. There are genetic and autoimmune diseases. So an autoimmune disease of the liver is, for some reason, the body's immune system sees the liver as an invader and begins to attack some part of the liver, which can result in damage. We see lifestyle choices affect our liver. So alcohol consumption. When it comes to alcohol use, some people experience fatty liver disease, where the liver starts to store a lot of extra fat, and over time that leads to swelling and scarring, just like we just talked about. We are starting to see a lot more people get what's being referred to as non-alcoholic fatty liver disease. This disease, NAFLD or NASH, this is as a result of poor diet, not getting enough exercise, having high sugars with type 2 diabetes or high cholesterol. Just remember, whatever your body sees, whether it's your food, your drink, medications, your liver will see it in one way or another. We're starting to see more and more non-alcoholic fatty liver disease in our country. So do be mindful about how your lifestyle might be affecting your liver. Reactions to medications, street drugs, chemicals, even some supplements can result in liver damage. Before you take any medication, whether it's something your doctor has prescribed to you, something you've purchased over the counter at the pharmacy, do make sure you're speaking to your doctor about any possible risks or implications to your liver. It seems trivial to say, but it is important to talk to your doctor about those over-the-counter medications you're taking. If you have a headache, what drug are you turning to? Are you taking aspirin, Motrin, Tylenol, ibuprofen? Make sure you're taking the right thing for you and your health, because everybody's health is different, and what's best for me might not be what's best for you. Also be sure to utilize your pharmacists or somebody like a specialty pharmacy. They are a wealth of information, and they are more than happy to talk to you about prescription and over-the-counter medications. We're now going to shift gears and really talk about viral hepatitis. So what is viral hepatitis? As I mentioned earlier, the word hepatitis simply means inflammation of the liver. This inflammation of the liver in viral hepatitis, this is an inflammation resulting from a virus. Basically, a virus has infected your body and has led to inflammation. There are many different types of hepatitis, several different letters of the alphabet. Whoever's naming liver diseases doesn't have all that much creativity. So hepatitis A, B, and C are the most common forms of viral hepatitis that we see in the United States. So we're really going to focus on those today. Hepatitis A, B, and C are all very different viruses. So having one doesn't make you more likely to get another. They're spread differently, and they're going to infect you pretty differently as well. We also manage these viruses in a different way. So hepatitis A, this is a virus that lives only in fecal matter. It's spread through ingestion of small microscopic amounts of poop that have been affected by hepatitis A. This is common through food. Perhaps somebody's at a restaurant and they're consuming food where the person preparing the food didn't properly wash their hands. This is likely to occur in a country where maybe they don't have the same sort of water sanitation practices that we experience here. Thankfully, here in America, we don't see a lot of widespread hepatitis A. We tend to see pocketed outbreaks of it. There was a large ongoing outbreak in San Diego last year. That has been well controlled. The Center for Disease Control and local departments of health do a very, very good job to protect people from hepatitis A. If you are exposed to hepatitis A, you will get pretty sick for a couple weeks. It's usually about a month to a month and a half of experiencing pretty severe symptoms, maybe jaundicing, yellowing of your skin. Some people might get extreme fatigue because remember, your liver's your battery. So if something's affecting your battery, you are going to fatigue pretty easily. The good news with hepatitis A is that it's totally preventable. We have a very effective vaccine for hepatitis A. It's a series of 2 shots. You get them 6 months apart, and that's going to protect you against the virus, even if you're exposed to it. Most people with hepatitis A really don't have any long-term side effects. There are some people who might experience a longer infection, or some people who may have a compromised immune system for some other reason and may face some more serious problems with hepatitis A, but most people are able to quickly recover and get back on their feet. We do suggest folks who have hepatitis C or another liver disease get vaccinated against hepatitis A just to avoid multiple infections in your liver. So now if we move on to hepatitis B, this is a virus which is much more commonly sexually transmitted as well as spread through blood. So hepatitis B is a virus that lives in blood and all bodily fluids. It's present in semen, vaginal fluid, and saliva. If you're exposed to hepatitis B, most people, most healthy adults can get better on their own. So you might hear something called an acute infection. Essentially with an acute infection, you've been exposed to the virus, but within 6 months of being exposed to that virus, your immune system is able to fight it off and you will get better on your own. The symptoms for hepatitis B are pretty similar to those for hepatitis A. Some people may never experience a symptom with hepatitis B though. Some people experience fatigue, jaundicing, they might get severe itching, they might get dark urine, they might start to see pale stool, but like I said, some people never experience a symptom either. When it comes to hepatitis B, where most healthy adults are able to fight this virus off on their own in that first 6 months of exposure, there's about 5 to 10% of people who will go on to develop a long-term chronic infection. That means a lifelong infection. Hepatitis B is a dangerous virus in that it can lead to significant liver damage, cirrhosis, or liver cancer if left unmanaged. There are medications which can manage or slow the progress of hepatitis B. And the really great news with hepatitis B is that we have a very effective vaccine. So the hepatitis B vaccine, this is a series, traditionally it's been a series of 3 shots. You get them spread out usually about 6 months apart from one another. And that series of shots would protect you from the virus even if you're exposed. Earlier this year, a new vaccine for hepatitis B was released, which is just 2 shots rather than the 3. For both hepatitis A and B, we do strongly encourage that if you have Hep C, you get vaccinated against those other two viruses. Like I said earlier, you don't want multiple viruses swelling your liver at once because it will just add more damage to the liver. With hepatitis B, we do, since about 1980s onward, if you were born from 1980s on, most folks have been vaccinated as children. And also with hepatitis A, we now vaccinate children over 1 year old. So it could be that you have been vaccinated. If you're not sure, or you just want to double check that you're immune to these viruses, you can ask your doctor to do a simple blood test, and that will show them whether or not you have an immune level of an antibody in your system. And if not, they may give you a booster just to bring you up to that safe place. So moving into hepatitis C, we're really going to shift gears here and focus on Hep C for the rest of my portion of the webinar here. For hepatitis C, this virus lives only in blood. So it is only present in blood and spread only through direct blood-to-blood contact. Essentially, the blood needs a way out of the infected person and into the bloodstream of the uninfected person. When it comes to hepatitis C, most individuals, about 80% of folks who are exposed to hepatitis C, will go on to develop that chronic lifetime infection. The good news with Hep C is that we have a cure. So while if left untreated, hepatitis C can lead to significant liver damage, new medications have resulted in our ability to cure people who have that chronic infection with Hep C. While we have a cure, we don't yet have a vaccine. So really, knowing what the risk factors for hepatitis C look like and trying to avoid those things are key. So I will dive into those risk factors shortly. Just one more note about hepatitis C. There are some people, about 15 to 25% of the population, who are exposed to hepatitis C and able to fight that virus off with their own immune system. More research needs to be done to really understand who is able to do that and why. But as of right now, it is likely that if you are exposed, you will more than likely go on to develop that chronic infection and need medications to get rid of the virus. So for hepatitis C is the liver disease caused by the hepatitis C virus. As I said, it's transmitted only blood to blood. And if left untreated, it can lead to cirrhosis, liver cancer, and liver failure. Currently, hepatitis C is the leading cause for adult liver transplants in the United States. The danger with hepatitis C is that people are able to live with this virus for decades, never feeling sick, but damage can still be happening in their body. So many people have no symptoms until more late stages of the disease. Personally, I had hepatitis C, and when I was infected, if you had asked me, do you have any symptoms of the virus, I would have said no, not at all. But after I got rid of my hepatitis C, I realized I wasn't experiencing the same itchiness that I was when I had the virus. I wasn't experiencing the same sort of fatigue. But while I had the virus, if I got itchy, I wasn't thinking, oh, that's my hepatitis C. I would write these symptoms off as something else. The best way to know your status when it comes to hepatitis C is to get tested. You can't rely on your body letting you know you have this virus. So should you be tested? So this list of possible risk factors is pretty strong. If you've had any one of these, we would strongly encourage you to get tested for hepatitis C. Before I go through these risk factors, just know that hepatitis C is a rather stable virus. This virus has the ability to live outside of our body for days to weeks, depending on the environment it's in. If there's a blood spill and there's even dried blood left out on a surface at room temperature, it can live up to 3 weeks and still cause infection. If there's blood left in a needle, say a syringe, they have found data that shows that virus can stay viable for up to 3 months. So if there is a blood spill, it's really important to use the right cleaning supplies. The CDC recommends 1 part household bleach to about 10 parts water, and make sure you wear gloves to clean up any blood spill. So when it comes to sharing of needles for intravenous use, it's not just the needle that can transmit hepatitis C, it's any piece of the equipment used for intravenous use. It's the cooker, the cotton, the water, any piece of that can transmit the virus and shouldn't be shared. If you have shared any of that equipment, please do get tested. Baby boomers are also supposed to be tested. So any individual born between 1945 and 1965 should be tested for hepatitis C at least once in their life. We see rather high rates of infection in this age range. Some estimate it's about 1 in 30 boomers were exposed to hepatitis C. If you are a baby boomer or you have friends or family members in that age range, please encourage them to get tested. I have had the question before, well, I was born in 1943 or I was born in 1967. By no means does that make you immune. You might still want to get tested, but the Center for Disease Control has suggested that all baby boomers experience a one-time screening for hepatitis C. If you have HIV, it is very important to get tested for hepatitis C. We see high rates of co-infection in this population. So many people have HIV were also exposed to hepatitis C. Whether it's somebody who is a man having sex with a man, received through injection drug use, or other risk factors that go along with HIV. When it comes to somebody having both HIV and hepatitis C, HIV causes the hepatitis C virus to accelerate the damage in your liver. So if you have HIV, please do get tested for hep C because it's important you get into treatment as soon as possible. If you've ever been exposed to a needle stick or blood, whether through your work or something along those lines, please do get tested. When it comes to hepatitis C, we didn't know what hep C was until 1989, and we didn't have a name or a test for it until 1992. So this kind of feeds back into that baby boomer population infection where we didn't know to test blood or blood products or organ transplants before 1992 for hepatitis C. So if you did ever receive blood products, or organ transplant before July 1992, please do get tested for hepatitis C. Any blood or blood products now being donated do get screened quite heavily before they're put into circulation. And if you've donated blood, and they would have to alert you if you do test positive for hepatitis C. If you've had abnormal liver function tests on a few blood draws, your doctor should check for something like hepatitis C. The thing with liver function tests, those are those tests that our doctors do pretty regularly at our annual physicals. Those can be easily influenced tests. So if I had a very fatty meal last night, my doctor checked my liver function test today, they might be a little high. If I went back though and had them retested, they would likely normalize back out. It's when those liver function tests or those liver enzyme levels stay elevated that's concerning, and that would then lead your doctor to look for something like hepatitis C. If you've ever been on hemodialysis for acute kidney failure, you should also get checked. Well, in hemodialysis centers, they clean their machines very, very diligently. Sometimes we do see hepatitis C be spread from one patient to the next. As I said, it's a risk, but hemodialysis centers do their absolute best to prevent this sort of infection. Also, being born to a hepatitis C infected mother. It's about a 5 or 6% chance that a baby would get hepatitis C from their mother when they were born. This is how I contracted the virus. Thankfully, I was able to be cured by the old medications, but this certainly is a risk, so it's important just to check your child. If you are a mother and you had a child with and you want to get them checked for hepatitis C, it's important to test them after about 18 months just to see if there is an infection that's present. These risks, also laid out by the Center for Disease Control, are a bit of a step down from those other risks that I just went through. So sharing of straws to use intranasally is a risk that can transmit the virus. If you're receiving tattoos or body piercings from an unregulated parlor or unregulated artist, that can be a very big risk. So when it comes to tattooing or piercing, if an artist is reusing needles or reusing ink, that can transmit the virus from one client to the next. So please do make sure that your artist is using well-regulated equipment and all sterilized one-time use needles and ink. So when it comes to sexual transmission of hepatitis C, it's not a very common risk factor, but it is possible. So remember, hepatitis C only lives in blood. Hepatitis C is not present in semen or vaginal fluid, but if there is a blood-to-blood interaction between partners, it is possible to spread the virus. So when it comes to sexual contact with a person who has hepatitis C, a condom would allow for a barrier between you and your partner. Sexual transmission is more likely to occur if somebody has multiple sexual transmitted diseases, as well as if it's a man having sex with a man, or for a young woman to get it from a man during sex. But there does need to be that blood-to-blood interaction. And finally, if you've ever shared personal care equipment with somebody who has hepatitis C, something like a razor, a toothbrush, nail clippers, or tweezers, just anything that might get a little blood on it, I always think it's best just to have your own set, don't let anybody else use it, and don't use anybody else's. To give you a little context into the personal care items though, I grew up in a house where 3 of us had hepatitis C, 3 of us didn't. I never gave hepatitis C to my siblings who didn't have it. However, I did keep my toothbrush up and out of the way of their toothbrushes. I made sure my razor wasn't confused with theirs. Little things that you can do just to make sure the others in your household are safe. But you know, at the end of the day, hepatitis C is not spread through any kind of casual contact. It's not spread through hugging or sneezing or coughing. You can't catch it by sharing food or eating utensils or drinking glasses. And hepatitis C is not in breast milk. So as long as a mother who is breastfeeding doesn't have any bleeding or cracking around their nipple, they don't pose a risk of spreading the virus to their baby. If a mother does want to breastfeed and has hepatitis C, and there is any kind of bleeding or cracking around the nipple, it's important she pump and dump until the milk is clear, and then she can go on breastfeeding. But remember, hepatitis C is only spread through direct blood-to-blood contact, so none of this sort of casual contact is going to pose a risk to anybody else. Moving on to how Hep C is diagnosed. So it is very common if you walk into an STD clinic and you get a finger stick test, or you ask your doctor to check you for hepatitis C. More often than not, they will start by checking an antibody. Whenever our bodies see a virus, whether it's the chickenpox or the flu or the hepatitis C virus, our immune system responds specifically to that virus and creates an antibody. If you have a positive antibody test for hepatitis C, that means at some point hepatitis C was in your body, your immune system responded to it, and that's why you're testing positive. It's something that your body has created because you were exposed to the virus. So if you come back positive on this test, simply think of it like a flag that says, yes, my body has seen hepatitis C. That's all it means. They'll then do a follow-up test called a viral load. If you have a positive antibody test and an undetectable viral load, that means you at one point had hepatitis C in your body, but it's no longer there. It's no longer causing damage. You can't give it to anybody. You don't have hepatitis C. So that viral load test is checking to see how much of the active virus is in your body. Undetectable means they can't find it. It's not in your body. I hear the word a lot when I'm out in the community. People ask me about Hep C being dormant. There really isn't such thing as a dormant Hep C. Undetectable means you don't have it. So again, to give you kind of a different context, I got rid of my virus in 2008, so that was 10 years ago. I still test positive for the antibody because I've been exposed. Once exposed, always exposed. If I have my viral load checked, and that's going to be undetectable unless I re-expose myself. So as of right now, I don't have hepatitis C. I have an undetectable viral load, but I do still test positive for that antibody because that's my body's memory of the virus. With the viral load, if that comes back with a number, that number can be anywhere from the hundreds to the hundreds of billions. Don't get really nervous if it comes back with a high number. Hepatitis C gets to work pretty quickly and starts to replicate. The viral load is not your level of sick, so it doesn't make you sicker if that number goes up or down. The viral load may speak to your doctor about how long you need to be on medications, but it's not a level of sick, so don't worry about that. So your doctor has done the antibody test, say you've been exposed. They'll then follow up with that viral load, and that comes back with a number, which means you have an active infection of hepatitis C that needs treatment. They'll then do a genotype test. The genotype test figures out which strain or type of hepatitis C you have. There are 6 different types, 1, 2, 3, 4, 5, and 6. Some of those do also have subtypes. I'm not going to get into those. I'm just going to stick with the genotype right now. So right now, when it comes to the genotype, there's really no good strain, there's no bad strain, there's no incurable strain. They're all treatable and they're all curable. So the genotype really just tells your doctor which medication is going to work best for you. There's now been medications developed for each and every type of hepatitis C, and different medications respond better or worse to different types. So your doctor will look at your genotype, figure out which medication is going to work best for you. They're going to stage your liver damage, whether through a FibroScan, an ultrasound, or a biopsy. They may even be able to do some deeper dive blood tests to really figure out how much damage is in your liver. Some people have more extensive liver damage, are going to be on medications a little bit longer than somebody else. If you tried treatment in the past, say you attempted an interferon treatment, that may also mean that you need to be on medications just a little bit longer than somebody else. But treatment now is much easier than it used to be. Up until 2014, we only had interferon-based treatments to take care of hepatitis C. The medications that are available now are all pill forms, so there's no more injections, and the side effects are minimal. But your doctor's really going to look at your genotype, whether or not you've tried treatment in the past, any other health conditions you have, and really hone in on the best treatment approach for you. When it comes to treatment now, there are some states and some insurance companies that have more limited access to these medications. However, places like NeedyMeds or even the American Liver Foundation can assist you in getting grants to cover unmet costs by your insurance company. So really working with your healthcare provider as well as the American Liver Foundation and our wonderful partners, we should be able to get you onto treatment. And the great news about treatment now is that new oral medications exist with very few side effects. So the medications that are available now, most of them are just one pill once a day. Most people can expect 2 to 3 months on treatment. Some people need 6 months, but 2 to 3 months tends to be the average length of treatment. And side effects are minimal. Most people have no side effects whatsoever. Some, the most commonly reported side effects are fatigue and headache. Some people might get a rash, and some people might get anemia where your blood count goes low. But compared to the old medications of interferon, these meds are a walk in the park. They are very easily tolerated, and you're only going to be on them for a short length of time. The hope of treatment, the cure, is a sustained virological response. What this means is that you will start your medications and pretty quickly your virus is going to go undetectable. Do all of the pills as your doctor prescribed. Once you're done with the course of medication, they'll bring you back 3 months later. If at that 90-day mark after your treatment has ended, your virus is still undetectable, that means the virus is gone and you're cured. The thing with hepatitis C is that, antibodies for other viruses, sometimes that gives us immunity, which means we can't get that virus again. With hepatitis C, you can always get reinfected. Say I have hepatitis C, I do my treatment, I go back after 3 months and I'm undetectable, but then down the road I'm re-exposed to hepatitis C, I could catch it again and need to be taken care of a second time. So once you get rid of it, do try to keep it gone. So when it comes to the cure, the sustained virological response, this does vary by individual as well as genotype. Most of the different types of hepatitis C now experience cure rates of 95 to 99%, and most of them and some of them are even as high as 100%, which is truly remarkable when you look at where we were not even 4 years ago with our interferon treatments. So in terms of living healthy with Hep C, this is possible. So really the best thing you can do for your healthcare is to stay engaged in your healthcare. You go see your doctor pretty regularly. When it comes to hepatitis C, the specialists who handle this virus or this disease are folks like a gastroenterologist who do the whole gut and the whole digestive system, a hepatologist who's a liver specialist, or an infectious disease doctor. This is a doctor that cures viruses. Do make sure you talk to your doctor about other health screenings that might be necessary. Like I said earlier when I was discussing the progression of liver disease, cirrhosis is the leading cause for liver cancer. So if you have advanced liver damage, make sure you're getting those liver cancer screenings. even when you get rid of your hepatitis C virus, that damage is still in your liver. So you need to make sure you're getting those screenings done, whether it's to watch your liver get better and better, or to make sure that you don't go on to develop liver cancer. If you have Hep C, like I mentioned earlier, please do get vaccinated against hepatitis A and hepatitis B. This is going to prevent multiple infections in your liver, and it's just going to let it stay a little bit happier, a little bit healthier, a little bit longer. And then as much as possible, following a healthy diet and addressing substance abuse is key. Both an unhealthy diet and substance abuse is going to result in liver damage in a healthy liver. But in the presence of hepatitis C, it's like doing double damage. So the nicer you can be to your liver, the longer it will stay happy and healthy for you. I think I'm going to turn it over to Cynthia in a minute, so she can kind of let you know what resources, and then at the very end of the presentation, I'll have Carla ask me some questions so Cynthia can throw the screen back to me. But I do want to really enforce upon you the importance of looking at reliable resources on online if you do go online to look up health stuff. Don't ever do like a symptom checker, just Google your health things and click on the first link. It's all too easy to diagnose yourself with a couple different kinds of cancer and be convinced you're dying tomorrow, and that's pretty bad for your mental health. Look at resources like the liverfoundation.org website. We do have a hepatitis C specific website. It's called hepc123.org. That is a great resource for all things hepatitis C. Our helpline, 1-800-GO-LIVER. We're also on Facebook and Twitter. We have an online support group called inspire.com. And then, look at those reliable resources, things like the local Department of Health, the Center for Disease Control, the National Institute of Health, or the VA, the Department of Veterans Affairs. Just remember, never let what you read online replace your doctor's advice, as your doctor knows your health better than anybody. So with that, I am going to turn it over to Cynthia to let her do her piece, and then towards the end, we'll turn it back over to me and I can take your questions. Thank you very much for listening to me, and Cynthia, take it away.
Well, thank you so much, Lindsay, for that wonderful presentation. I think it was greatly informative. I hope a lot of people out there learned much more about viral hepatitis. So I'll go ahead and jump into my portion of the presentation, which is talking about ALF's educational resources. I have the pleasure of working on our national helpline here, which, as Lindsay mentioned, is 1-800-GO-LIVER. Last year, we fielded over 9,000 inquiries, and that includes we do phone calls, we do emails, we have a live chat function on our website, which definitely, if you have time, visiting liverfoundation.org is great. We newly renovated the entire site, and there's a lot more resources available. And in the vein of talking about viral forms of hepatitis, we actually newly updated and created our hepatitis B brochures, which are available in English, Spanish, Chinese, Korean, Vietnamese, and Russian. If you are interested in a copy of brochure, if you click this link here in the presentation, it'll take you right to the website. Our pieces are free of charge for people to download and print. They come in PDF form. If you are a provider or from a clinic, you can reach out to our helpline as well if you might be interested in having a material like this for your patients in your offices. So this is our hepatitis B brochure. And our other brochure we have available is for hepatitis C. That particular brochure we have available in English and Spanish. And if you are interested in that particular copy, again, if you fall under the website link here, it'll show different diseases of the liver. So if you scroll down, you'll find under hepatitis C, you'll find both the English copy and the Spanish copy there. We're very happy and pleased that we're always updating our resources and materials. So we do encourage people to check back into the website from time to time because we have a lot of great events and different information available for people. And to wrap up my portion here, again, our national helpline is 1-800-GO-LIVER. The purpose of our helpline is to listen and respond with the most current and helpful information available. We're available from Monday through Friday from 9 a.m. to 7 p.m. Eastern Standard Time. If you'd like to give us a call, that's great. We also field live chats on our website, which again is liverfoundation.org. Or if you'd rather send us an email, the email for our helpline is info@liverfoundation.org. And that pretty much wraps up my portion of this part of the presentation. So what I'll go ahead and do is pass off the screen to Carla, who will help field the questions, and Lindsay is gracious enough to help us answer some of those questions that you guys might have had along the way. So I thank you both, and I will go ahead and hand it back to Carla.
Thank you so much, Lindsay and Cynthia, for what I'm not surprised at all was a very thorough and informative webinar. I am just a reminder. Cynthia said we're going to field questions now. I do see some coming in, and again, you can type those questions you may have into the questions section of your GoToWebinar control panel. If we don't get the chance to answer your question, we'll follow up with you personally via email. I just want to take a moment. Lindsay had mentioned during her portion of the webinar that getting access to the medications you need can sometimes be a bit of a barrier. I'm mentioning that, but what Lindsay did mention during her presentation is that the American Liver Foundation, as well as NeedyMeds, will hopefully be resources that you can rely on if you're having difficulty getting access to the medication or healthcare needs that you have. What you're looking at on your screen right now is a slide that lists some of NeedyMeds' most popular cost savings databases on our website. I'm not going to take the time to go over them. I just wanted to make sure that you knew that we were here and that we hope, in addition to the American Liver Foundation being a source of support for you, that NeedyMeds you would consider NeedyMeds one as well. I do also hope that you join us for future special topic webinars, and you can find those on the bottom right hand of the NeedyMeds calendar of events. Just a quick reminder there. And what I wanted to put up while we're fielding questions is the contact information for the American Liver Foundation. And you can also see NeedyMeds toll-free helpline and website at the bottom as well. Before I field questions, I just wanted to share a little anecdote with our audience. Lindsay, Cynthia, and I did a quick practice webinar yesterday. I always like to do that to make sure we all have the technology under wraps. And Cynthia had to be late. And the reason was because she sent both Lindsay and I an email and said, sorry, I'm going to be late. I'm dealing with somebody who called in through the helpline. And I was just not surprised but moved, because really the patients and the people that contact them are by far their priority, as evidenced by the way Cynthia behaved yesterday. So I really can't stress enough what a wonderful partner they are to NeedyMeds, but more importantly in this webinar, hopefully what a great resource you will find them to be as well. So with that being said, I want to also remind everybody that you can find the handout section, the presentations. Let me get that right the third time. The PowerPoint presentations that I used and Lindsay and Cynthia used in the handout section of your GoToWebinar control panel. And if for some reason you have difficulty downloading them, or possibly I did something wrong when I uploaded them, don't hesitate to let me know. You can send me a message in the question section, or you can certainly email me after the webinar. So we've got quite a few questions coming in. And I think these first couple sort of fall under the same umbrella, and Lindsay and Cynthia, I'm not sure which one of you would field this, but we have somebody writing in saying that back when they were in college in the late 60s, the person was in hepatitis, the person was in the hospital, and they mentioned that this individual had hepatitis. They didn't find out what kind it was, and they want to know, should they be tested now, even though it's so many years later? And we have a similar question, I think, coming in of somebody saying that they may have happened many, many years ago to been exposed to hepatitis. And what would you recommend for these two individuals? And most importantly, should they be tested?
So I think this is Lindsay speaking. Thank you for those questions. So as I said in the presentation, we didn't know what hepatitis C was until the late 80s. So a lot of people who were diagnosed with hepatitis prior to that are a viral hepatitis. Some people were told this is a non-A, non-B hepatitis. It really doesn't hurt to get checked for hepatitis C. If nothing else, you'll get some peace of mind to let you know that you don't have hepatitis C. And if you do go to your primary care physician, those are free tests for both you and for them. So it really shouldn't provide any additional charges for you. And remember, the word hepatitis means inflammation of the liver. So sometimes people can get alcohol-related hepatitis where they've had too much to drink, and that causes inflammation of their liver. I would strongly encourage you to go to your doctor and just reiterate what you've just asked me, saying that you were at some point diagnosed with hepatitis, and you want to make sure it's not hepatitis C. If it is hepatitis C, it could be that it resolved on its own. You were in that small portion of folks who can clear the virus with their own immune system, but it could be that you have that longer term chronic infection, so it's important to get you into treatment as soon as possible.
Thank you so much, Lindsay, and thank you very much for also adding that it shouldn't be an additional expense for either the doctor or the patient to get tested. And again, I want to stress if somebody is going down a path where they do require medication and don't have what seems to be more and more considered a luxury in our country to have comprehensive healthcare or drug coverage, we do hope you give us a call here at NeedyMeds to see if we can find a program that will help you afford that medication, or at the very least, we can provide you with a free and anonymous drug discount card. Another question coming in is, let's say you get a needle stick from an unknown source. How often, and I really like this question because I think this is something that probably a lot of our audience maybe think as well. How often should you get checked for hepatitis A, B, and C?
That's a great question. So when it comes to a hepatitis C test, that could take as many as 6 months for the antibody to test positive. Our bodies take different amounts of time for that immune system response to occur. So I would say get tested shortly after the needle stick, and then just go and get tested at least 6 months out after the last risk factor for A, B, and C. If within that 6 months you're not testing positive still, I would say it's pretty safe to consider yourself okay. But our immediate response is to run out and get tested as soon as possible, which is a really good reaction. But do make sure that you're getting that at least 6 months. So, say I had a needle stick today, I want to go 6 months from today just to make sure.
Thank you so much, and thank you for being so specific about the time frame. And thank you to our audience for participating and asking such great questions. Another one coming in, we're going to switch gears a little bit. This individual wants to know if somebody has end-stage renal disease or they're a dialysis patient, and this may be a little bit tricky because it may only be particular to this situation, but if there is a patient with end-stage renal disease or dialysis, receiving dialysis, can that person receive Hep C treatments?
I don't know the answer to that question. I don't know if Cynthia has any input. I know that there are some limitations towards who can get hepatitis C treatment based on what we call comorbid or diseases that happen at the same time. I don't specifically know about kidney disease and Hep C treatment. I've not read literature that says that they can't, but I'm a little hesitant to answer that question. I think that would be a great one for your doctor.
And when that question came in, and I'll share this with our audience, if there's a situation that that really wouldn't fall under a straightforward answer, sometimes I won't ask it aloud, and I'll have our guest panelists get back to you privately. But what I wanted to really showcase is just the transparency with which the American Liver Foundation professionals will respond to your inquiries. They will do their best. If the answer is not straightforward in your case, they'll let you know that as well, and I think that's really important. Just another question coming in is, what is the screening process for HCV?
So the screening process generally starts with that antibody test to see whether or not you've been exposed to the virus. If you come back negative on that antibody test, you have never been exposed to the virus, your body hasn't seen it. That is, again, as long as you didn't have a recent risk factor. So that means you've not been exposed and you're good to go. Should you come back positive on that, it does mean that at some point, Hep C has been in your body, that virus was seen by your immune system. So your doctor will then go into those follow-up tests of a viral load to see how much virus is present in your body, and then really move on to see what type of hepatitis C is there, and really hone in on how to manage your virus should you need management.
Thank you so much, Lindsay. To our audience, we're going to go ahead and wrap up this afternoon's webinar because we are running out of time. I wanted, of course, thank NeedyMeds partner, the American Liver Foundation, Lindsay and Cynthia, for sharing their expertise with the NeedyMeds users and audience and directing us to the national helpline as well as the website, which I'm sure our audience will agree is just a wealth of really invaluable information for anybody that wants to have a healthy liver. I do, again, hope you stay in touch with NeedyMeds by visiting our website, subscribing to our YouTube channel, following us on our social media platforms, and certainly joining us for future free special topic webinars. We do look forward to your keeping in touch. Thank you, everybody, for taking time out of your day to join us. And thank you again, Lindsay and Cynthia, for a wonderful, thorough, informative presentation. Have a happy, healthy rest of the week. Thank you, everybody.
Thank you, Carla and NeedyMeds, for inviting the American Liver Foundation to take part, and good luck to everybody on the line. And always feel free to reach out to the American Liver Foundation, whether it's your local division or the national helpline, for additional support, information, and resources.
Fantastic. Thanks, everybody. Take care.